Today I wanted to talk about supporting supplements. I know a lot of us are looking for like the one supplement solution. I have spent so much money on supplements, it's wild. And every time that I get a supplement, my husband just makes fun of me because every time I get a supplement, I'm like, this is gonna be life changing, and it never is. It's not just one thing. It's a puzzle. It's a multi-piece puzzle. We have to put all the pieces together. But there are some supplements that can support us in doing that. So, and of course, like I can't prescribe you anything, I'm not a doctor, even if I was, like, I don't know your history, anything like that. So you need to be working with your medical professional. You need to, if you're interested in any of the supplements that I talk about, obviously, like, run it by your doctor, your pharmacist, and don't just go taking a bunch of supplements. So the first one I want to talk about is a really common deficiency. It's so common, and it's vitamin D. Vitamin D deficiency is just like rampant. Vitamin D plays a really vital role in your immune system and all kinds of things. Like vitamin D is responsible for so many different things. Super, super important. So ask your doctor to get your vitamin D levels checked if you haven't already. Get on a vitamin D supplement if you're low. If you take it with K2, it just helps it absorb a little bit better. So vitamin D and K2. Yes, vitamin D. And actually there's a study, I forget where it was at, but there was a study university did on chronic urticaria patients, and I believe it was like 40% of them had a significant reduction in their symptoms when they supplemented with vitamin D. So vitamin D is the first one to consider. Another one would be your probiotics. Now, probiotics, when you have histamine issues, is like really tricky because some probiotics actually cause release of histamine. So again, we have to be careful. I really like the Seeking Health brand. It's probiotic histamine X. That's the one that I take. I'm gonna keep it in the fridge. It's specially designed for people who have histamine intolerance, so they don't have those strains in there that are going to release histamine. And then they added some strains in that help degrade histamine. So if you're interested in that, you can get that through my dispensary at a 15% discount if you're interested, or you can find it online. But that's a good one. So yeah, so we need to work on our gut health. A lot of us have imbalances, which we'll talk about more later in the week. But if you add in a good probiotic, that can help your gut health and then ultimately help. Again, it's another piece to the puzzle. So the third one I want to talk about is a DIO enzyme supplement. And DIO is an enzyme that you have in your gut, and that actually helps like process these dietary histamines that we have, that we consume. And, if you have a damaged gut lining, which a lot of us do, or some people have genetic predisposition to just having lower amounts of DIO, maybe not having as much DIO as other people. So if you're in either of those situations, a DIO enzyme might help you process those dietary histamines. Now, this enzyme has to be taken with your meals. I only really take it if I have a really high histamine meal, but, as I said, I do things a little bit different, and my symptoms are fairly well controlled at this point. Taking that enzyme with your meals will help process those excess histamines. And again, like, these aren't like cures. Like, there's no cure. This is symptom control, and this is getting things under control and lowering that bucket. Seeking Health DIO enzyme, you can get that in my dispensary as well, or just look online. And then another one I want to talk about is quercetin. So quercetin, you've probably heard about. It's a mast cell stabilizer. You can get it in a lot of foods. I like to, try to concentrate on food sources. You can, I actually have a list in the guide of antihistamine foods. So a lot of those foods are high in quercetin. That's what, gives them their antihistamine abilities. So, but it's just a mast cell stabilizer, so it helps the mast cells to not degranulate so much. Like with chronic spontaneous urticaria, like your mast cells are degranulating more than they should be. So it's just kind of helps stabilize those cells. And you know, like there's so many different supplements that you can take. But it's really dependent on you, you know, in your unique situation. You definitely want to work with a practitioner if you're able to. You know, a lot of nutritional deficiencies do contribute to our symptoms. It causes extra stress on the body, and you know, you need nutrition. And a lot of times, you know, we put ourselves on these elimination diets and we eliminate too much, and we end up just, you know, depleting our body of these important nutrients that you need. Your body can't heal if it doesn't have nutrition, right? So, you know, a good high quality multivitamin too, you know, might be helpful. But, you know, as I said, it's really going to depend on you, you know, your particular deficiencies and needs and all that. Vitamin E is another really good mast cell stabilizer. Again, that's something that you want to ask your physician about. It does have, you know, it can be harmful if you take too much, if you have large amounts of it. So, but it's just another one to consider. B vitamins. I could go on and on. But I just want to name a few. I don't want to overwhelm you. And as I said, like, I don't want you to just take a bunch of supplements because you're not going to know what, you know, what's helping and what's not. Work with your doctor on that. If nothing else, I would recommend, if you feel that you have histamine intolerance, I would recommend the Seeking Health supplements that I talked about, and definitely ask your doctor to check your vitamin D levels. So hope that it was helpful. Again, if you need the guide, put guide in the comments and I will get the link to register